Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. In this video, we're going to talk about aortic aneurysm as well as hypertension and peripheral disorders. So an aortic aneurysm. With this, we have a local distension of the aortic artery wall, usually thoracic or abdominal, and we monitor until it's about 5 centimeters, and when the rate of the rupture increases, surgery is usually required. So what are the causes? Atherosclerosis is the most common cause for this, infection, inflammation disorders, as well as tissue connective disorders. Some signs and symptoms for this: with our abdominal, we'll notice a pain, which will be persistent or intimate, low back pain, flank pain, as well as a pulse. You will palpate abdominal mass. With our thoracic, we'll notice pain, dyspnea, hoarseness, cough, as well as dysphagia. Some diagnostic procedure used to diagnose this include CT scan, MRI, X-ray, as well as ultrasound. And what is our nursing care or nursing information for this? Treatment will be often include surgery for this patient, and preoperatively, before the surgery, we'll monitor systolic pressure at either, it should be between the range of 100 to 120. We'll give them medications like beta blockers and hypertensive medications. And just to also we'll monitor for rupture manifestation, which will be intense pain and decreased blood pressure. And after that surgery, we will always carefully monitor for peripheral circulation below the level of the aneurysm, just to make sure there's circulation. We'll high medication of stress of the artery on the suture. We'll always check for that. We'll also have, and a decreased blood pressure could indicate as well as hemorrhage. So we'll be monitoring for decreased blood pressures as well as after the procedure, post-operatively. And there will be some complications that you will need to watch with this patient after surgery, which include hemorrhage that we talked about, infection, renal failure due to poor circulation, arterial occultation as well. Let's talk about hypertension. Hypertension is one of the diseases that we really need to know it in and out because it's mostly predominant. Hypertension and diabetes are one of those disorders we really need to know. What is hypertension? And hypertension is persistent blood pressure above 140/90 mmHg, often called a silent killer because most people really don't know they're hypertensive. There are various types of hypertension. We have primary hypertension and secondary hypertension. So with primary hypertension, this is our most common type of hypertension, and it's 90% of the cases that we have. This causes could be either hereditary. Causes is actually unknown why it's hereditary. It's more common in African American males, and its late manifestations include headache, fatigue, dyspnea, edema, nocturia, and blackouts, right? That blood pressure is really high. And usually no manifestations until an organ involvement occurs. Like, that's why it's a silent killer. Somebody wouldn't know they're hypertensive until the organ is failing. I'm not peeing or I'm not breathing that well. Our secondary type of hypertension is due to identifiable causes, phenochromatocytoma and renal pathology. Like, you know what this is, right? With primary, we really don't know what the cause is, but with secondary, something is causing secondary. And what do we educate patients in regards to this? We teach patients about weight maintenance, right? Obese patients are prone to hypertension. We encourage them to stop smoking. Like, smoking is a cause to every kind of disorder that you can think about. So we encourage them tobacco cessation and as well as decreased alcohol and caffeine consumption. We promote program of regular physical exercise and lifestyle that reduces stress, right? We need them moving. Obesity is another factor that can lead to hypertension. We encourage a sodium restricted diet, and because we know with hypertension, we are having a cardiac issue, right? And salt increases volume of, fluid volume, because wherever salt goes, water follows. We need to decrease that volume, and we'll encourage them to use the DASH diet. And what is a DASH diet? With a DASH diet, we have increased fruit and vegetables. It's also low in fat, dairy, and limited saturated fats. So remember that. It's a question, right? They'll ask you, the patient is on a DASH diet. What is a DASH diet? A DASH diet includes increased fruits and veggies, low fat dairy, as well as limited saturated fats. These patients, we can treat them as well with medications, and there are various medications we can give them. It includes like loop diuretics, our diuretics, right? Thiazide diuretics, and intervention for diuretics include, right, with our loops, we administer potassium supplements because they are wasting potassium, right, with loop and thiazide, and as prescribed, and dietary potassium. We monitor for hypokalemia. Hypokalemia increases the risk of digitalis toxicity. And with our potassium sparing, our spironolactone medication, we monitor for increased potassium. We can give them beta blockers, the orals, the propranolol, metoprolol. And with metoprolol, it can help them lose weight, right? That's one of its side effects. We also monitor this patient for our bradycardia and pulse daily, manifestation of heart failure. Non-cardio selective beta blockers are contraindicated for asthma patients because non-cardio selective beta blockers. So cardioselective beta blockers include metoprolol and etanolol, and the rest actually are non-selective, so they have side effects of bronchospasm. So with our asthma patients, we really need to watch that. We monitor for hypoglycemia for diabetic patients, making sure it doesn't occur because they mask that. We can give them central acting alpha blockers. They can also be on angiotensin acting converting enzyme, our ACE, which inhibits our RAS system, as well as our calcium channel blockers. And with this, we have nifedipine, verapamil, and diazepam. Okay. Our next disorder that we're going to talk about is our peripheral vascular disease. And this includes both our peripheral arteries and venous disorders. So with our peripheral arterial disease, this impairs blood flow in the arteries that carry oxygen. Remember, arteries carry oxygen away from the heart. It's most common in the arteries of the legs. Signs and symptoms of these include immediate claudication, like pain and cramping when walking, and revolves with rest. It resolves itself with rest. So these are patients, remember, they're having these circulatory issues, and if they're having lack of oxygen, these cells are not perfusing well. No energy, no nothing, cramping, right? Calf muscle atrophy, shiny skin, hair loss, and thickened nails due to poor circulation, poor neurovascular integrity, necrotic ulcer, looks like a pushed out or no edema presence, right? And the legs because of lack of circulation, tingling and numbness of the toes, and cold extremities with poor pulses. Those are common signs and symptoms for peripheral artery disease. What are our interventions? We encourage these patients to be on tobacco or quit smoking, tobacco cessation. We promote exercise, right? Walking at least 3 times per week, and as well as weight reduction. With our cardiac issues, lifestyle is a biggie. We need to do modifiable lifestyle things. Dependent position relieves pain, so we depend our legs to push that oxygenated blood down there. We could administer some medication for them, and surgical treatment could be performed like femoral popliteal bypass surgery, as well as angioplasty or stent placement. With our peripheral venous diseases, it interferes with an inadequate or adequate return of blood flow from the legs. It includes venous insufficiency, VTE, and varicose veins. What are the causes for peripheral venous? This is venous deoxygenated blood, prolonged sitting down for a long time, prolonged sitting, obesity, pregnancy, and thrombophlebitis, right? Thrombophlebitis. Some signs and symptoms of this include stasis dermatitis, like brown discoloration, edema, stasis ulcer, typically found around the ankles, right? Poor circulation. Nursing interventions for these patients will do what? Will elevate those legs for 4 to 5 times throughout the day. Will avoid crossing legs, constrictive clothing or tight stockings, or and we'll apply compression stockings because these tight clothes, they prevent efficient or adequate circulation. So let's talk about the various types of peripheral vascular diseases. So VTE, venous thromboembolism. This is the collective condition of either DVT and pulmonary embolism, PE. Some causes of this, of course, we've talked about immobility. It could be aftermath of surgery. That's why our surgery patients, we make them walk, right? Mobility. Trauma, obesity, age of greater than 65, cause, degeneration. Spinal cord injury, disorders of coagulation, pregnancy, as well as oral contraceptives. Signs and symptoms of this include edema of the affected limb, local swelling and bumping or naughtiness. We could notice some red color, tenderness, or local induration. Venous ulcers are usually around the ankles. That's one thing you need to know. They're usually around the ankles. They're red and blushing, as well as edema is often present. And we diagnose this peripheral issues with either an MRI, CT scan, or ultrasound. So with these patients, what do? We normally, our nursing interventions include, we monitor for heparin and warfarin therapy. That's our PTT and INR. We administer thrombolytic therapy. We assess for bleeding because we are thinning this patient's blood. We elevate affected extremity, apply warm and moist compresses, right? And we monitor for signs and symptoms of a PE. And what are these? It will include dyspnea, chest pain, tachycardia, as well as anxiety. And prevention of VTE, early mobilization, leg exercise, compression stockings, we'll do it intermittent compression device, and also prophylactic subcutaneous heparin do help with. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.